Hello, this is Dr. Do again. This video is on alphabetic list problems, still on letter M. Today I'm going to talk about, actually in general, managing health individually. Not for medical professionals, of course, this is for general population. And you probably know it, but I just have this video to remind, because it's not just for patients. Everybody is a patient in the world, including physicians themselves. So this is managing the health in the concept of compliance with the professional instructions, unless your knowledge is approved by the professionals. So in terms of this managing health, it's such a comprehensive, such a broad topics. You can include from the sky to the earth, from the trees to the stones, everywhere. But in general, for individual, how to manage health. First of all, like I said, comply with your medical or professional instructions, and otherwise from your physicians, especially when you're getting older, to the age that everything starts to showing downhills. This is the reality. I'm not discouraged, you know it. And so then follow the guidelines for the physical exam, and discuss with the physicians, and follow the compliance. That's the first concept, actually, in terms of managing health, come to my mind. So you have, this is, I think, the benefit for physicians to improve their knowledge from keep seeing patients, keep seeing different variety of presentations and the thoughts and the minds. And at the same time, physicians' years of training will have a great impact on your life to manage your health. And also, as in addition to that, I think managing health, it's really, there's some fundamental foundations of the core of managing health. First one, know yourself. Each part, like I said, individualize each patient, each person, the same organ. For example, the liver residing in your body is different from the liver from residing in the other. So it's the heart, the brain, everything. So individualize, know yourself with fundamental knowledge, the major organs, functions, the major systems, what they do, and the connections, just brief, superficial, but you need to know those. Start from young, when you have time. Gripping every minute to know yourself, to learn about you in terms of the way of thinking, the genetic, any genetic diseases around the family, any causes, not natural death, of the causes of unnatural death, anything occurring in the family. So that from that you know yourself, and on top of that, pay attention to yourself from daily, the way of thinking, the schedule, what is the best to fit you in terms of maintain mental health. This is probably the spiritual or whatever you say. Keep thinking positive. That's the other important. In addition to compliance with your physician, know yourself, then keep the mind positive. There are a lot of things going on. I understand, especially for young people, actually, their life start to battle on a daily basis, have to deal with so many things. They have parents, and they start to establish their family, and the work, the career, the academic, whatever. So it's really dimensional, dynamic. So this is have to keep the mind positive, knowing that these are the challenge everybody has to deal with, just different layers, different height, different intrinsic intelligence to handle different things, and try to manage this. I think in terms of this, I do not have much to say. I have to acknowledge that I'm not excellent, but this is the theoretically you have to keep the mind on the optimal and happy side in order to really to motivate it. In addition to manage your daily duties, motivate it to manage your health. So this is about the fundamental. And these are really non-medical related. In terms of medical related, I stratify into different ages. If you're young parents, if you have young children, then your attention probably on the children. So pay attention to their health, daily activities. Some children do not hide. So if they're usually very happy, active, but suddenly stay in the corner, not seeing too much, either physically probably had some fever or viral infection, or emotionally probably you need to pay attention to catch that moment along with their growing, so you know them, and if there's something going on in that child's life, you identify it early and then bring to the professionals to get help. So this is about children. And for the young people yourself, you're busy, and if you feel like I mentioned, the common occurred disease in young healthy people, I mentioned before, usually it's really not serious. Could be just the viral infection, or this you know it, or you periodically check your mind. Is there anything to drag you? And then are you falling the category of anxiety, depression, or any post-traumatic stress disorder, anything like a psychological or mental, not in a perfect state, anything of this, either in the disease stage or just impaired function. So periodically, once in a while, ask yourself whether these are in the category you should consider. And for older people, I also think the very important age group which really facing the daily challenge of health. In addition to you look back, you're proud of what you have done, or you just average, or whatever you have regrets, but the life is need to restart, readjust, find some time to look for the happiness, and also to look after your health. And that is not only for you and for your children to lessen their burdens and the societies. So what are the signs you're looking for? In addition to follow your physician, ear physical, and those are the signs. If you have any days start from probably subtle process, you realize, oh my God, since 3 or 6 months I did not have energy to do anything, and you need to re-gear up to see your physician, to talk your family, to talk to your physician, to present this to them, see what advice they can give you. Or if you physically really have some headaches or blood pressure, periodical check, and also if you have chronic diseases, then make sure your medications update, your follow-up visit with your physician update. So these are really kind of trifle, but it's important. It's like a small brick building up the buildings. So individualized, and also this individual small aspect really put together. It's the well-being, how to manage your health, and how to manage well-being as individual function to meet the society requirements, to lessen the burden especially for the older people. So I think this video is really not just medical. I think I just put everything from what I see, from what I can think, together to stratify in different age groups what a priority they should put in terms of managing their health. So I'm going to stop here, and I hope it helps, and thank you for watching. I will see you next time.